It's the Florida RoundTable, and each new cancer diagnosis, whether it's from someone in the public eye or a close family member, kind of serves as an important reminder that cancer can impact anyone, especially if you're not paying attention and you're not caught up with your recommended screenings. With that in mind, I have Dr. Simarta Brennan-Prescod with me. Dr. Prescod, how are you today?
Hello, good afternoon. Thank you so much for having me. I'm doing great.
Oh, I'm so glad. Now, the fight is far from over when it comes to cancer. Can you explain why, not just the pandemic, but why people are falling behind on routine cancer screenings? What's happening?
Well, I want to start with we've come a long way, but we still have longer to go.
Okay.
The truth is the pandemic put us back a couple steps. Routine cancer screening is essential for our health, but that knowledge has to be there and resources have to be there. So we have to start talking about the barriers people are having to getting this done.
Okay. And what are some of the barriers?
Well, the reality is pre-pandemic, economic inequalities are going to be a role. Can I afford it? Do I have a primary care to refer me? Do I understand what the process is and what the benefit is? A lot of access issues is education and knowing where and when to go.
That makes sense. Yeah. There are a lot of critical breakthroughs, as you did start up, we're getting in places that we need to be. And the field of oncologic medicine, a lot of breakthrough. 4 million breast cancer survivors so far in the United States, which is a huge number. Actually, it's bigger than any other cancer survivor group. But the fight's not over, as we just said. Are we talking about breast cancer screenings? What kind of cancer screenings are we talking about, Dr. Brennan-Prescod?
So I am a big believer in all cancer screenings. The top ones that we're looking at, obviously, is colon cancer. This is Cancer Screening Week. So we want to talk about colon cancer screening. We want to talk about breast cancer screening. We want to talk about prostate screening and lung cancer screening. These are the 4 main essentials that have come such a long way with new innovation and options. I always tell people, even within my own practice, the goal is to find it early. Nobody is giving you cancer. Unfortunately, it actually is there. But if we can find it early, there's a huge difference.
So that would obviously...
If you have time...
I'm sorry.
Yeah.
Would...
If you have time, I'll tell you a little story.
I do.
I have 2 sisters that I took care of, lovely women. One got her mammogram done. The other was, I'll put it off. Both ended up with breast cancer.
Oh, my.
Now, the one who got the mammogram finding, that was a 2-month emotional experience. The doctors acted on it, took care of it. She's cancer-free. The sister who didn't, we found it through a lump. Now, that is a 2-year process. So the emotionality, the time, a lot of people don't realize the benefits of early detection. And I've seen it forehand, and I always tell that story.
Yeah, well, it's a great example of either the quickness of being able to diagnose and deal, or the obviously 2 years with a lump. It's just, it's common sense, but it's not common enough right now. And we've got to get out there. Right now, this segment is called Act Now Against Cancer. Don't wait to get your cancer screenings. I've got Dr. Brennan-Prescod from Optum. You're an internal medicine practitioner, right?
That's correct. I take care of people from the age of 19 to 101 in my office.
If you're 102, you're out of luck.
I know, right? The truth of the matter is we love on our patients through early prevention. We are very passionate about screening, and it's about education. I find if you find the root of the source of perception, you can change that perception and get this done.
It makes sense. What are the hardest people to reach when it comes to getting folks in for cancer screenings?
The hardest for me is actually men. And I don't need to throw it out there like that.
Hey, it's call them out. It's true. If it's true, it's true, Dr. Brennan-Prescod.
I find men, the visual is not there. This is something I need to do right now. Maybe I can put it off. So I find if you simplify and explain benefit, you'll get through. I find there's racial disparities.
Mm.
There are differences between Hispanic, African American people versus their Caucasian counterparts in screening, whether it's getting it done, finding cancer, mortality related to it, survival related to it. We need to have set focuses, bringing them into the flock of education and the importance of the screening process.
Sounds like we need some community outreach when it comes to cancer screening. Now, what groups are more at risk than others for cancer and cancer mortality?
When we talk about groups, we know African Americans are at higher risk of cancer mortality in comparison to their counterparts that are Caucasian. And we're talking rates like, 40% for Black women. Sometimes, and I give credence to whoever needs credence, 25% decreased screening around the country has happened during the pandemic. That's, people that would have been found early. And it really hit hard in a lot of the socioeconomic status lower areas physically. When you compare in comparison to the Hispanics are not, people just withdrew, I feel, during the pandemic, and then that just put us back so far in the education towards what's needed.
I see. Yes, folks, you got to do this. Get the cancer screenings, and the earlier, the better. Maybe, what do we routinely screen for? Can you tell me what cancers we routinely screen for?
So, try and true, I always want people to get their colon cancer screening. There's also, science has made multiple ways to get that done now.
Poop in a box. Mm-hmm.
Yeah, I always tell people, if there's a poop in a box, then take care of a colostomy bag.
Mm-hmm. Yeah, most definitely. Yeah.
and I tell people all the time, it's perspective. And what I try to do is give them the perspective of, you can do screening, colon screening, literally just testing the stool for blood.
Mm-hmm.
I actually advocate a lot for my younger patients. I want you to get your first colonoscopy. I want you to get it 45.
That's when I had mine.
Family history
Yep.
of anything a little earlier, get it with the appropriate age and screening. The thing is, you got to talk to your doctor about it.
Yes. You reminded me of something. You reminded me of something. We're talking with Dr. Simarta Brennan-Prescod. When I was younger, and my grandmother on my dad's side had breast cancer, and in the 60s had the entire breast removed. And I wanted to get screened when I was in my mid-20s. They refused to do that. Is there a way around that now, especially if you have a history of that for women? Just wondering.
That's a good question. What it is we know more now.
Oh, good.
So now that we know more genetics, now that we know more the correlation with family history,
mm-hmm.
We now extrapolate that, and then we have different screening tools based on that.
So if you have a history, there's a way around that, and you can do it, because they say, come back when you're 45. I'm like, I really want to be on top of things. Yeah.
Mm-hmm.
Yeah.
What you want to do is plug into your primary care, have a discussion about it. At our office, we want to know mom, sisters, the whole gamut.
Mm-hmm.
And then we now take that information and apply it to the appropriate screening. And I can't tell you how many, early screening has done so much for people. The longevity, the survival rates.
Now, what about now we're doing oncology with regards to cancer screening, colon in particular, colonoscopies. Also, want to talk about breast cancer and lung cancer, and all those things are all can be detected with an early screening. Is that right?
That is correct.
See, people.
The big thing is knowing risk factors. You got to go in, talk to your primary care. Go to your health department, have that discussion about what your risks are. If your risks are different or if they're age appropriate, we want to start the process.
Doctor, where can we go and get more information? I'm sure my listeners would love to follow up.
Absolutely. The CDC has multiple screening options. One thing I like is we need to realize that even if you lack the economic irregularities towards being able to have a set primary care, there's still screening options.
Of course.
You can go to the health department. The Affordable Care Act has now made it that you can actually get these things covered. So we want to realize that times have changed, resources have changed. We need to recognize that first stop, your health department, your local physicians who are there
your
for you.
County is community clinics. They're often what do you call it? Religious-based hospitals out there will help you. All those resources are available. You're right, doctor. They just have to get up and do it. Put it on your calendar. First thing, make that your New Year's resolution, right?
Exactly.
Doctor, it's been awesome. This has been Dr. Simarta Brennan-Prescod on Florida RoundTable. Thank you so much for visiting us today.
Thank you for having me, and have a wonderful Christmas.
Oh, thank you.